Hello, I'm Dr. Mike. Today's VetVid episode is on senior pet care. We're going to discuss why senior pets should be examined, what the veterinarian may be looking for, and what tests may be performed. Dr. April Miles, a veterinarian in Rancho Santa Margarita, California, is going to give us a brief introduction on this important topic.
A pet may be considered a senior at about 7 years on average if you're going to take all the breeds and sizes together. But small breed dogs do tend to age less quickly than giant breed dogs, for example. So if you're looking at a Great Dane, I generally say about 6 years of age is a senior, whereas a tiny dog may be 8. So average 7 years of age. Senior exams are really important, and I recommend them at least every 6 months because they age so much faster than we do. We can pick up subtle changes that an owner may not see. We listen to the heart and lungs, we can hear murmurs, arrhythmias, we palpate the abdomen, we can find masses. An owner may find an ear infection or know that their dog has bad breath, but we may be able to pick up on diseases before the owner's aware of them and help prolong the patient's life potentially. Specific questions that your veterinarian may ask you that can key us into various underlying disease processes is increase in water consumption, increase in urination, change in defecation behavior or eating, like if your dog's eating a lot more, activity level, changes in breathing, exercise intolerance, stuff like that can clue us into maybe an underlying disease process going on with your animal. Your veterinarian can also provide you with advice on special diets for your senior pet, especially certain breeds do have certain needs as they get older. Exercise that could be good for your pet, especially if they have certain diseases, joint disease and stuff, we can discuss what exercise is appropriate. Or if they have heart disease, we can discuss that with you. Your veterinarian may recommend blood work or a senior wellness profile. These are sort of pre-screening things where we're looking for maybe renal insufficiency, kidney disease, liver disease, just any sort of changes. We also like to perform a urinalysis as part of that senior wellness profile, and a fecal, just a basic screening to try to find diseases early before the owner is noticing a change in their animal.
Many veterinarians recommend that a senior pet be examined at least twice a year. There are very important changes that take place in a senior pet that may not be clinical. In other words, your pet may not be showing any signs early on. However, your veterinarian is trained to pick up these early changes on a physical exam. I recommend that your pet have routine blood and urine tests performed at each of these visits. Picking up a problem before your senior pet is sick may make all the difference in their quality of life.